Good afternoon, everybody. I'm Roberto La Ragione, a Professor of Veterinary Microbiology and Pathology at the University of Surrey and Chair of Trustees for Humanimal Trust. It's my pleasure this afternoon to introduce our guest, Professor Noel Fitzpatrick, who's a Professor of Orthopaedics at the University of Surrey, runs a referral practice for veterinary medicine, and you may know him as the Super Vet. Welcome, Noel.
Thank you, Rob.
So 10 years ago, you had the vision for One Medicine and set up Humanimal Trust as a charity to deliver that vision. Can you tell us about One Medicine and why it's so important to you?
One Medicine, or One Medicine, however you choose to pronounce it, I would say is my central life goal. Without wishing to sound prosaic, I believe it's my purpose of being on planet Earth. And I have felt that since I was 10 years of age. So it's kind of appropriate that it's our 10th anniversary. Because when I was 10 years of age, I had a deep love for our farm dog, Pirate, who was chained up in a shed on our farm. And to everybody else, he was the farm dog that would get in sheep. But to me, he was my best friend. And I was having difficulties at school and various other things that happened in my life. And he truly was a listener, a companion, a confidant, and I developed a bond that I would say transcended humanity. So I felt way back then a oneness with him, and that very much influenced my choosing to be a veterinary surgeon, because I don't just love animals in the sense how I say I love animals. I feel like I relate to them on a deeper level, and I felt throughout my teenage years and then as I went into veterinary school, chained to a wall like Pirate, because I kept asking the question, why am I not allowed to give the same level of medical care to animal patients as I would be if I had chosen when I was 17 and a half years of age to be a veterinary surgeon rather than a human doctor. I remember vividly the day that I got offered both human medical school and veterinary medical school. It's a funny thing about medicine, they're both medicine, but when we think about medicine, we think about humans. And I chose animals because that was my preference, and therefore throughout my education and then my early career, I was increasingly frustrated because I realized it was true. I couldn't give animals the same level of care as humans got, in spite of the fact that animals were used in experiments to give those very same treatments that I wanted for my patients to humans. And I just didn't think that that was fair, equitable, or rational. And so I did a lot of exams, some of which you helped me to sit because you were one of my mentors, thank you. And I wasn't particularly bright. I've never been particularly the brightest spanner in the box, truly not. I just work hard. And I work hard for one reason, and that is One Medicine. Because this charity isn't just a manifestation of something that I founded 10 years ago. It's a manifestation of an ethos, a philosophy, a way of being in every single day of my life. When I see an animal come in to see me with their family, their lives unravel in my consulting room. In my consulting room, it's like the ultimate hairdresser because they tell you everything. And I frequently go through people's cancer, their own diseases, the death of their loved ones through the eyes of their animal and the crisis they find their animal in. And in that world, they truly want the same level of care for their animal friend as themselves. And bear in mind, I have gone through large animal practice. I grew up on a farm and I was a cow vet, sheep vet, horse vet, and then ultimately specialized in companion animals, and then ultimately in neuroorthopedics. So for me, One Medicine, I think the drive of your question is, what does it mean to me and why did I start the charity? I believe it's not just an important thing to do for the world. I think it's an essential thing to do for the world. We live in a world of ever dwindling resources, and unless mankind recognizes the symbiotic relationship we have with animals, we will have to deal with the consequences, as is exemplified by the recent pandemic, and as is epitomized by global warming and deracination of species. 50% of all vertebrates on planet Earth gone in my lifetime. And so I dedicate my life to giving animals a fair deal so that every being on planet Earth, including your children, including my generation, the next, have an Earth and an ecosystem which is fair and helps all of us to have a better and more optimal existence. For me, One Medicine exists at the level of medicine, where we treat, also at the level of society, where we respect, and more fundamentally at the level of creation, because we are all animals. It's the most important currency on planet Earth, in my opinion.
Fantastic, Noel. It's really great to hear your journey for One Medicine. And I think for the Trust, one of the things that we've developed is thinking about the 3 R's and actually the 4th R, which is reciprocity. For you, what does reciprocity mean, and why is it important to our Trust, and particularly now that we've reached our anniversary year?
So most research councils in the world adhere to the 3 R's, which is reduce, refine and replace animal experimentation with other models, whether that's organ on chip, whether it's the new advent of AI technologies, whether it's other technologies that are coming on stream for biomodeling and so on. And reciprocity as a word is something that I have always felt should be part of the R quadrants, as opposed to a triumvirate of reduce, refine and replace. So reduce the number of animals that are used in experiments, refine the experiments so less animals are needed, and replace animal experiments where possible. But we live in the real world, and right now in 2024, which is our 10th anniversary, we as a charity recognize that every medical funding body on planet Earth is currently guided by regulations and sometimes laws that dictate what they can or can't do to provide drugs and implants that are safe, effective, and don't do harm. And to do that, an experimental animal model has been necessary over the last 250 years. And in that quarter of a millennium, human and animal medicine have diverged. And I would like to reconverge them with this attitude of reciprocity. And reciprocity to me means a fair deal for animals. And I'll put it into context with 2 examples. One, when I evolve a new implant system for a joint replacement in a dog, and I know that that works over 5-10 years, that isn't instantly translated into a human joint replacement. No, we have to do an experiment on an animal, kill that animal, after we induce the disease in a normal animal to prove what I already know. That doesn't seem rational. The flip side of that coin is when a drug is developed for a human, such as a cancer drug, in my field osteosarcoma will be a good example. If a human medical company, a drug company, invests many tens of millions of dollars in the development of a new drug, and experimental animals are used to give that drug to human beings, I cannot get access to that drug because that company has not spent the money necessary to license the drug for animal use, in spite of the fact that animals have given their lives to give it to us. So I am still treating animals for bone cancer with a drug that's more than 20 years old, carboplatin, when I know there is better treatment, but I can't get access to it. And that absence of reciprocity is a massive motivator for me to try and create a new paradigm.
How do we make that access better? What do we need to do? What can the Trust do to help you and other veterinary surgeons to be able to access those drugs in the future?
If we are to boil it down into its essence, frankly, I think it's largely about money, because the world rotates around money. Secondly, it's about prejudice and precedent, because we've always done things a certain way. And thirdly, it's about recalcitrance to change and a certain ignorance and arrogance about it. So if we deal with those in turn, money, we have to prove to drug companies and implant companies that it will be cheaper, more cost effective to run in tandem, well-founded, ethically well-based clinical trials in animals and humans contemporaneously to decrease the time of pipeline development. But in order to do that, we have to move on to the second point, which is regulatory approval. Because there is no point in having a situation where a vet or a human doctor is potentially putting their license to practice on the line if they're not backed up by their governing bodies and by regulatory approval at government level that says these are clinical trials that are entirely ethically well-founded, well-structured, and have good governance. And then if we move on to the third aspect, we are talking about a recalcitrance to change because we've always done things a certain way. In the world around us, things are changing so rapidly with the advent of AI that our world in 10 years will be dramatically different. Just recently, a study was done in America comparing the diagnostic skills of human physicians to ChatGPT. ChatGPT came out on top because it had access to all that information, which can be used for good or for bad. We look at the wars that are going on in the world. AI can be used for bad. We look for the good. It can find metastases on scans quicker than my human eye can. And then we see this good and bad changing in front of our eyes, and we are at this crossroads of civilization right now. So the attitude that nothing can be done is no longer acceptable, because change is going to happen anyway. It's whether we embrace that change and make it progress. So for me, the biggest progress can be a sitting down with the regulatory bodies of both human and veterinary medicine and creating a framework which takes a drug or an implant trial from mouse to dog to man, as some people have already done in America, in an ethically well-founded way to not only reduce, refine, and replace animal experimentation, but also reciprocate so that animals win too. And for me, the fundamental to that is money. In this world, you have to make it clear to all of those people how their reputations are not affected, except enhanced, and how they can make as much money or more by doing it in a way that helps all beings. I think that's the biggest challenge.
Great, and I think the Trust has a pivotal position in taking that forward. In one of the areas that we've talked a lot about is spontaneous disease and how we capitalise on the fact that both humans and animals suffer from disease. We've got high numbers in particularly common diseases such as the cancers and metabolic diseases. How do we access those patients? How can we use that to best effect so that we're not using experimental animals, but actually we're using cohorts of animals which have got the most natural disease, and we can follow the full course of disease from diagnosis right the way through to hopefully resolution of that disease. How do you think the Trust can help clinicians to be able to access and navigate the different issues that surround clinical studies with spontaneous disease?
Well, I know better than most the pain of being at the coalface of clinical disease that is extremely difficult to treat. And I see patients from all over the world that come to see me having failed other treatments, having not had most optimal treatment, and being asked for a solution. And then there's an ethical line. Can we provide quality of life in a reasonable time frame? So the first and most fundamental thing that the Trust needs to recognize is we cannot have a blunderbuss approach. We cannot say one size fits all. We have to pick projects that are going to be proof of principle projects. And to do that, we need to explain to society the difference between naturally occurring disease and experimentally induced disease. So to put that in context, things that I was trying to help animals with 10 years ago, I was, and I don't mind saying this openly, I was accused of experimenting on animals in my clinical practice by fellow veterinary surgeons. And I don't say that lightly, because I want to put out love into the world. I don't believe in hatred, and I don't believe in victimization, and I don't believe in othering other people. I believe in conversation, dialogue, resolution, and peace. However, those same techniques I've now written about, that it goes into a textbook in 2025, and it's common practice. something that I was doing 15 to 10 years ago, and that will happen again. But there's no need for all that acrimony. We need to understand that well-founded clinical trials can be set up, but it requires recognition that naturally occurring disease is an excellent model in animals for naturally occurring disease in humans, and I'll define that in a moment. Secondly, we need, as I've already said, our governing bodies to sanction those clinical trials. Thirdly, we need to educate the public and the guardians of dogs and cats and other companion animals and say to them, look, if you've got drug X that we've been using for 25 years and we know what it does, it provides a median survival time in this cancer of, say, 11 months. We've got drug Y that we feel is really, really promising, or we've got this immunotherapy, or we've got this, and it's really promising because we've got X, Y, Z. Do you want to enroll in this? That's pretty much like pediatric human medicine, where you ask a parent guardian to consent on behalf of a child. The regulatory environment needs to be in a situation where people like me, who are at the coalface of these difficult diseases, are not victimized. But it's not about me. It's about recognizing the homology between a naturally occurring disease and an experimentally induced disease. So I'll finish the answer to this question by dealing with that head on. Nobody in research can argue that an induced disease is equal to a naturally occurring disease, and it's well recognized that naturally occurring diseases in animals are a far better analog for naturally occurring diseases in humans. Homogeneic, or cell populations that are highly the same, injected into an animal model in cancer, is a less reliable test model than a heterogeneous cell population, which is in a natural stroma growing inside a body. In layman's terms, that means the naturally occurring cancer that actually occurs in me or you or a dog is more alike to each other than inducing that disease in a normal animal and then treating that disease. And in fact, there's more commonality between the cells of those two cancers in you and a dog than there is between the cells of the dog and the cancer or your normal cells and the cancer. They're that similar. So naturally occurring disease in dogs, cancer, osteoarthritis, respiratory diseases, all very similar to human diseases, and therefore what I would like to see happen is that we set up clinical trials that explains to the companies who are going to be developing the next generation of treatments that they can save money and that they can deliver the drugs or the implants or whatever it is quicker to their patients by doing it in a naturally occurring disease model without any of the clinicians being involved with that having any qualms or prejudices imposed upon them.
Thanks, Noel. Today we're very much talking about One Medicine and what it means to us, what it means to our scientific and lay communities. To me, it's clear what One Medicine is from everything that you've said today. But why do we find it so difficult to bring our medical and veterinary colleagues together to actually talk about One Medicine and actually action it? We've got something that's simple, and as you said right at the beginning, with medicine, they're both medicine, veterinary medicine and medicine for humans. Why is there this separation? Why can they not come together much more easily?
Okay, so 250 years ago or so, human and animal medicine diverged. In the time of Leonardo da Vinci, he was drawing pictures of dogs and humans at the same time. In the time of Theatrum Anatomicum in Bologna in Italy, they were dissecting dogs and humans at the same time. They were recognizing this commonality. And then a divergence occurred for various cultural, religious, and scientific, egotistical reasons, whereby the human species was considered superior because of our cognitive capability. I mean, it seems crazy to me. I've known some dogs that are way more rational than some than me on some days. But my point there is that once a precedent is set in a human mind, it's extremely difficult to change. If we have a precedent historically, it's extremely difficult to change entrenched opinions, and that's human nature. Some people, I will give them all the evidence and they still won't change their mind because their father believed that, or that that's what they learned in school, and they're just intransigent. So I believe there's a big psychological blockage in othering animals from the point of view of they're lesser creatures in the minds of most people. Well, if that were the case, I shouldn't be allowed to deliver the best level of care to your dog or your cat. Really? How does that make sense? I could have become a human surgeon and I wanted to deliver my best level of care to them. But importantly, apropos your question, I think it's vital that we recognize the sentience of all species on planet Earth. It's a controversial issue, sentience, feelings, needs and wants. It's vital that we define that one medicine is not One Health. What I mean by that is that the One Health initiative is hugely confused by even people in the know and is not understood at all by the general public. But One Health, in a nutshell, has garnered a lot of research money because, especially after the pandemic, people want to study environments, how animals like bats and pangolins are brought into close proximity with humans, how viruses are transmitted, how bacteria are transmitted. But the key difference between One Health, which is the study of all of those environmental factors, physiological factors in humans and animals that influence disease, and One Medicine, is that One Health primarily benefits humans. In other words, most of those efforts are funded because it helps humans in those environments or in any environment. One Medicine, completely different, because it decides ab initio from the beginning that it's 50% for animals. It's 50-50. It's fair. It's a fair deal. Animals get the treatment, humans get the treatment. We're not doing this just for humans. So I would say that the elevator pitch for One Medicine, when you get into an elevator and somebody asks you what it is, I think it's really important to use an example. And it's difficult if that person has never felt the love of an animal, a dog or a cat or a horse or whatever. Really difficult, because some people haven't. And I've had human doctors say to me, well, it's only a dog. Well, why would you bother? Even though they admire what we've done. And that's not their fault. It's not their fault. That ignorance is born from education. But in a nutshell, if I was to say, I would say, do you know, or have you yourself loved an animal? A dog, a cat, a horse, whatever? Yes. Do you know anyone that has? Most people know someone that has. Yes. Do you think they want the best level of care for that animal? Let's call that dog Freddie. Does Freddie deserve a treatment for his arthritis or for his cancer? Most rational people would say yes. Does it make sense for me to be using a drug that's 25 years old, or a drug that I know that exists that's 2 years old and is significantly better? Well, of course it makes sense to use a new one. I can't use that, mate. I'm not allowed to use it, because though it was developed in animals, it can't be used for Freddie. And they would go, why? That's One Medicine. We need to change that so that all medical developments are freely available to animals and humans at the same time, and that requires money, which we can make available by saving money doing the clinical trials on naturally occurring disease.
Fantastic. No, you touched on a really important component of the One Medicine area, but particularly looking at some of the actions of the trust, and that's education. We are really keen to think about education at all levels. What do you think is the most important thing that we can be doing now at our 10th anniversary to educate those in schools, but also those at university studying for veterinary medicine, dentistry, medicine, and other allied subjects?
I think that I've learned this from television. I've been doing television now for a long time. 20 years, I think,
20,
maybe.
yeah.
I don't know, a long time. 2010 was the first TV show. So yeah, more than 20 years. Television's all about the hook. The hook. Before I came into this chat with you, one of the people outside in the foyer came up to me and very kind of half embarrassed and asked me to sign a Vetman book for his child.
Wonderful.
And he is a human medical specialist, like I am a veterinary medical specialist. And he said, I feel a bit embarrassed, but my son has read this book 4 times. Now, what does that mean? I wrote a story about a superhero called Vetman, because Vetman was made up in my mind when I was 10, misunderstood by the world, I thought, and my friend was Pirate, the dog I referred to earlier. And Pirate and I would go off on adventures, and Vetman and he and I would save the world. And I wrote that book to reach out to 9 and 10 and 11 and 12-year-old kids, and some 5-year-old advanced readers still come up to me and they say, oh, I get it now, we're all one. Yeah, we're all one. And I think, truly, I believe this, that the generation after me are more cognizant of the oneness of the world and the limited resources on the world and climate change and deracination of species than my generation ever were. I believe that they have immense compassion and immense capability to make the world a better place, and I sincerely, I really do believe that they are potentially less greedy and less usurping than my generation have been. Now, you asked, what could we do education-wise? They say you can't teach an old dog new tricks. I disagree. I've changed a lot in the last 20 years myself. I don't believe you can't. I'm learning how to play guitar. I wanted to do that since I was 10. I thought I could never play guitar. Well, I might never be as good as Brian May, but I could try. So you can try to teach an old dog new tricks. So you can focus on that, but that's much harder. It's much harder to teach me guitar than a 10-year-old child. So in the age group of 10 to 25 to 35 to 45, the people who are going to be around for the next half century, they know that the only way they're going to reach the next half century is if they look after the world they're in. So I believe it's essential that the Humanimal Trust reaches out to those people and taps into the collective consciousness of oneness that everybody felt in the pandemic, that is a little bit dwindling now. But we need to tell them, look, I get you. We're all in this world together. What can we do together? If everybody says we can do nothing, well, nothing's going to happen. Always do what you've always done. You'll always get what you've always got. But it only takes one Greta Thunberg to change the world. It only takes 10 or 12 or 15 or 20-year-olds to change the world. And it's our moral responsibility to inspire them to do just that.
Yeah, I completely agree. And we have a wonderful opportunity with the Trust to do that with our education officers and all the activities that we're doing with schools and universities. And
when I sit down with a group of 300 or 400 school kids, and they're between the ages of 5 and 11, as I have done on the Vetman book tour, and I sit there and they say, oh, you're never going to keep them quiet. They'll go mental. All I have to do is talk about a puppy, show them some trabecular titanium and say, this is a honeycomb, and we're going to build a new hip for our puppy friend George. And then they're like, whoa.
Transfixed.
And then they see that they've got a hip themselves, and they know it's not that different. So I believe that the challenges are in our minds and not in theirs. And it's our job to try and influence them positively so their minds open rather than closed.
Yeah, I agree. The storytelling is so important.
It has,
analogies,
it has to be a story. People can't relate to an abstract thing. You can't just say, oh, one medicine, you should do that. No, you have to say, my dog has cancer, but I can't get the best treatment. How can I make that happen? My granny has cancer. We want the best treatment for granny. Of course we do. How can we make that happen? Boom. That's one medicine.
Yeah, absolutely. And hopefully in the future we'll be able to push these boundaries forward and do a lot more.
Yeah.
So the Trust in the last 10 years has done a huge amount. It's funded projects, PhDs. We've raised the profile of One Medicine across the UK and much further afield as well, and made many new relationships. In the next 10 years, what are your hopes for the Trust? What are the main things that you want us to be doing in the next 10 years?
So the term One Medicine wasn't invented by me. It was invented by a guy in the 80s, a vet in America. And it was a wonderful phrase, One Medicine, because it united us all in oneness. I took on that baton from him and other well-meaning people before that. And my job, the central goal of my life is to hand that light on to the next generation. So the three things that I would like to see that we achieve in the next 10 years. Number one, a universal appreciation for the fact that we're not alone on planet Earth, and that animals, not just our companion animals, but animals in the wild, animals around planet Earth, deserve respect. Bear in mind, if we as a species were eradicated tomorrow, I can guarantee you that one or other animal species that are not us would survive.
Yeah, absolutely.
That would happen. You got to put that in context. We are just part of planet Earth. So it's a universal recognition of sentience is a controversial word because, you know, where does that cut off in terms of the ability to think, feel, whatever. So I'm not going to go into that. I'm just going to simply say respect, not othering animals, because we are animals too. So that's the first thing, respect. The second thing is reciprocity. So it's another R, which is, do we really want a world in 10 years' time that does not give your dog the best cancer treatment, even though dogs and other animals were sacrificed to give that treatment to us? No, I don't think we do. And I don't think the next generation do. I think there's no good rational reason not to make that treatment available for dogs. And in doing that regularly, to set up a new paradigm whereby we reduce, refine, replace, and hopefully obviate the need to do the experiment in the first place. So reciprocity, I think we need to make a currency for medicine. So you've got reciprocity, you've got respect, and then the third thing is regulation. I think the thing we really need to aim for is a change in the regulatory biases that have historically banned animals, and I use that term quite vociferously, from the medical advances that they themselves engendered. That's ludicrous. What am I doing with my life? Am I really going to spend 60 years of my life from the age of 10 to the age of 70? If I'm lucky, maybe not, a few more, who knows?
Hopefully.
Are we really going to say, no, never mind, you don't matter? No,
not
our regulatory bodies need to recognize the importance of working together. And in a world which is full of war, in a world which is full of man's inhumanity to man, this is one area where we really can identify a low-hanging fruit, a win of compassion. It's easy to love an animal. It's easy to do that, and in so doing, you're loving your planet and you're doing the right thing. So, reciprocity, regulations, and respect. That's the next 10 years.
Fantastic. Well, Noel, we've covered a huge number of different topics, and it's been absolutely fascinating talking to you about all of the different areas and how one medicine weaves into both medicine in humans and in animals, and how we bring the two together. Is there one thing that you would like to say specifically to all of those that support us, our volunteers, our staff, everyone that gets involved in the trust, really to take One Medicine forward? Because everybody that works or is associated with the trust is passionate about it. But what is your message to them going forward for now at the 10th anniversary of the trust?
We love you. Look directly at camera. We love you, we love you, we love you, and thank you. But apropos your question, I have had periods in my life where I felt intensely alone, intensely vulnerable, sometimes even hated, which I took deeply personally by members of my profession and by people outside my profession for doing what they deemed to be pushing things too far, but what I knew for sure was trying to provide a quality of life in a reasonable time frame. And I know very well where the ethical line is. And I've put to sleep more dogs and cats than many people because I see the worst of the worst. So I know what euthanasia looks like. And I know what my own transience looks like. You and I are going to die, Rob. That's just life.
Unfortunately.
So my message to everybody out there is, if you want to build a better world in any way, don't other each other. And that includes animals. Don't other them. Embrace them. Be present with them. Be in the moment with them, and realize that they are giving you something which, although it doesn't share our language, is a language nonetheless. And it's a language of love, it's a language of respect, it's a language of empathy, it's a language of comfort and compassion and understanding. And my God, if we had all of that in a pill, we'd all take it.
Absolutely.
And we're giving you that medicine. We're giving you that pill. It's called One Medicine. And it gives you all of those things because it gives you the fulfillment and the peace of mind of knowing you're doing the right thing for your family, for yourself, for the animals in the world, and for the planet. And I would say to everybody who supports us, thank you. Thank you to those who have in the past and who will in the future. But most importantly, this is in your interest. It genuinely is in your interest, the interest of your children, and in the interest of this planet that we live on. In fact, I will go so far as to say it is the most important currency on planet Earth, because without health, you have nothing, because you can't achieve anything. And therefore, every other goal you have becomes immaterial. And I can absolutely guarantee you that unless we embrace the concept of one medicine in the next 50 years, health will suffer as a result. So thank you so much for believing in the concept that can and will change the world for the better.
Thank you, Noel, and I absolutely agree with everything that you've said, and I add my thanks to everybody that supports the Trust. I think the most important message is that we are all equal. We all need to work together more, and we need to bring that reciprocity to life and make it happen going forward. Thank you, Noel, for your time
No,
today.
thank you.
It's been an absolute pleasure.
Thank you so much.
It's been really enjoyable, and hopefully we've enhanced the One Medicine message for everybody.
Yeah, the One Medicine message is going to resonate way beyond our lifetimes, and it needs to start here now on the 10th anniversary of the Humanimal Trust to ring a big bell across the world and say, look, we all need to have good health, optimal quality of life, and to take care of those we love. And those we love should include the animals too.
Absolutely. Thank you.
Thank you.